if you own the mile-plus long train that just crashed and created an epic, still unspooling disaster with consequences that span multiple states and potentially multiple generations, flowers, I'm sure, are nice. But the question in East Palestine tonight is, how much help is that community going to need, not just now, but for years to come? And importantly, right now, who will get to decide that? Who will set the appropriate monitoring and assistance in motion? Who makes sure things are put right now and for good? Joining us now is Ohio U.S. Senator Sherrod Brown. He met today with people who live in and around East Palestine. He told people there today, quote, "I am here for the long haul." Senator Brown, I really appreciate you taking time to talk to us tonight. I know this is a really busy time for you.
Thanks, Rachel. It's wonderful to be back on your show. Good to see you again.
It's good to see you, too. What do you think people should understand about the impact of this disaster and the impact on people in East Palestine that's maybe missing from the national coverage and the national discussion about this so far? What can you see from up close, from having been there just today, that we might not be able to see from a national media point of view?
Well, your intro into the story was exactly right. It's what it's doing to people now. We did a roundtable of sorts with 15, 20 local people, some from the local foundation, city council, sheriff, commissioners, townspeople. We did it. A woman owns a candle shop, and I think 3 generations, her daughter is helping her run it now. 4 miles away from their shop, they own 40 or 50 beef cattle. And what's that mean for them and people buying that? So there's all kinds of down the line, the water is safe. The mayor says it, the EPA says it. They all are saying the water is safe in the East Palestine water system, but a lot of people have wells. We don't know about beyond there, and we don't know, as you say, generation after generation what this means. So the reason I said I'm there for the long haul is, one, to make Norfolk Southern, who, by the way, just announced billions of dollars in more stock options for their stockholders, especially their executives. That's how they give them such extravagant pay. They announced that the day before, said they were about to the day before the derailment. So we're holding them accountable. That's my biggest job. But also, what do you do with the second generation and third generation? So that's why I'm there for the long haul.
I was interested today to see a letter that you co-signed today with the junior senator from Ohio, the new senator, Republican J.D. Vance. Now, you and Senator Vance obviously come from very different parts of the ideological number line, and you're very different men and have very different approaches to things. But that makes it all the more interesting to see both your signatures on this letter to the EPA and the CDC saying, hey, we need to get out there right now and get a medical baseline, do voluntary collection of health indicators from people in this community so that if there is a health impact over time, we have baseline data that everybody agrees is good data that we can use so that any health problems in the long run can be incontrovertible. I have to ask you about the substance of that request, if I have it correct, and also what it's been like to work with Senator Vance on this.
Yeah, I don't know Senator Vance well, but he's seeing the same things I'm seeing. He's talking to a lot of the same people I'm talking to. He realizes the severity and the seriousness of this. So we're teaming up, even though we don't know each other very well. We are very different. We have very different ideologies about government, the approach to government, but we both see this is really important. Bill Johnson, a local, very conservative Republican congressman, represents most of the river counties. He and I have teamed up on a number of things, too, on this. And, Rachel, when you were talking, where my mind goes on this, when you think about long-term impact, to a bill that Senator Tester and I wrote, a bipartisan bill, and passed what was called the PACT Act. And those soldiers, hundreds of thousands of our soldiers in Iraq and Afghanistan, were exposed to these football field-sized burn pits in those countries and are beginning to develop all kinds of illnesses. We listed 23 illnesses based on medical assistance and medical advice, cancers and bronchial illnesses that could come from those burn pits. And we're kind of approaching this the same way. These can be 2 years, 5 years, 10 years down the line, and we want to make sure that we've covered those things. So I bring sort of that experience of the PACT Act as a member of the Veterans Committee to this and figuring out how do we look at this long term.
Senator Sherrod Brown of Ohio, it is really good to see you, Senator. It's been too long. Come back to the show soon. Keep us updated on the situation in East Palestine, and have your office keep us apprised as to what's being done at a concrete level. We want to keep it on the air, sir.
For sure. And I'm thank you. And I'm planning on another trip in March. They're going to see me a lot there, and I've got a really good relationship with the mayor and the sheriff and some on council and some citizens, and we'll keep talking by phone, and then I keep showing up. So that's really important that they know somebody's on their side on this, and that's just my mission and my job. Thank you.
Senator Sherrod Brown of Ohio. Thank you, sir.